You're all tuned into GhanaTouristCoachRadio.com. And again, we are streaming from Alexandria, Virginia. The number to dial in, even if you have your apps, we have 712-432-8428. Okay? And it's your health, it's your wealth with Dr. Ampomah in the studios. Now, Dr. Ethan, when we were looking at the transmission of HIV, you realize that HIV is transmitted by our three main routes. We do understand that we have the sexual contact route, exposure toward body fluids or tissues. And then again, we're also looking at from what? Mother to child, what? During pregnancy, delivery or breastfeeding, obviously, which is also known as what? Vertical what? Transmission. Now, I want us to kind of help our listeners over here, especially when it comes to the mother and child what issue. Okay, pretty much when it comes to the sexual side, pretty much know that you talk about that. Now, the mother to child, we understand that HIV can be transmitted from mother during the pregnancy or during the delivery, and then through what? Breast milk. Now, this is the third most common way in which HIV is transmitted what? Globally. Now, with your knowledge and with your insight and research into HIV and based upon your studies that you've done, can you shed some light in that regard when it comes to mother-to-child transmissions?
One of the things for this prevention of mother-to-child transmission is one, knowing that you have the HIV. Mm-hmm. Two, the medications that you would take, the antiviral cocktails. In doing that, there is something very special about the placenta and the way it is filtered. If a mother would take the antivirals, the chance for the child being HIV is very low, significantly low, into the 5% chance that they would actually be infected with the HIV virus. In studies within the U.S. and within Virginia, that has lowered to 1%. Based on one, how the child is delivered by C-section, one, that they do not recommend breastfeeding, and thirdly, that they would actually do early prevention. So what we have here is kind of a trifecta effect, and in some countries, they're saying that if a mother takes the antivirals, that it's okay to do breastfeeding. However, there is a risk in that. So we have to assure that we understand that in doing that, we are taking a risk. It may be smaller, but if an individual, if we're talking about prevention, who actually takes the antivirals, the drugs related to HIV, has a greater chance not transmitting that to another. So with the intervention of the medication during pregnancy, the risk is lowered.
I see. So, in somebody's going to say that in layman's terms, right? If somebody is just to go out and say, you know what, I heard from Ghana Tourist Coach Radio, they're talking about HIV, and we're looking at mother-to-child transmissions. In this day and age, the possibility of what? Of contracting the virus or whatever, is it still high or it's low?
Okay, I'm not sure I get the total part of the question, but the possibility of contracting the disease from mother to baby, if the preventive drug cocktails, the antivirals, are in place, is lowered, and significantly lower. But you have to assure that you're seeing a proper health care. You're checking your viral loads, you're understanding what your viral loads are, and you want your viral loads to be undetectable during pregnancy. And you also want your helper cells that keep you healthy above a level of 200. And those are actually some statistics in regions in the U.S. So we do know that works in Europe as well. So those who are reporting say that it does reduce the transmission.
Okay, so I see that you were talking about viral load has to be in a certain specific numbers.
Right.
Of course, you're looking at very lower than 200 and
well, a viral load you want to be zero.
Right.
A T helper cell, which prevents the body from it being destroyed.
That's right.
The cells being destroyed.
Yeah.
You want to be above 200.
Okay.
And actually, in our normal bodies, if you're not HIV, you're going to run around 10,000. But they have found that as low as 200 will prevent the disease from actually destroying tissue.
Okay. Then could you shed light on CD4 count then?
CD4 count is really in the body, if you looked at this under a microscope, it would look like a spike. And in these spikes, they would count the number per blood cell, and they would actually take the virus and they can actually just take it down to just keep it from injuring the cells.
Okay.
So that's what the T cell actually does. It prevents that cell, it prevents other things from coming in, it absorbs them, it keeps it from coming in and actually causing disease states and destroying other tissue.
Okay. So in any case, when we want to look at, let's say your CD4 count should be what? Very, very what? Low. And I know that in most cases where people who have the virus have had their CD4 count going way up, we're looking at 600 and 800 and above, then that is where you have the disease process manifesting itself.
That's right.
Now, individuals who've had their CD4 count very, very low, pretty much haven't shown any symptoms of it. That means they are pretty much walking around like any other normal individual. So, I know there are personalities out there who have had they've kind of come out to say that I have HIV, but my CD4 count has always been in check. That means they're living their lives like everybody, because the CD4 count also are pretty much you're looking at them as macrophages, which of course they are also going to protect your body from any outside entity or attack. That's right, coming to attack you. So once you have it to a certain level, then you have your body functioning,
normal immunity.
Yeah. Any more light on this?
Well, the CD4 count can actually be significantly high. It can be as high as in the 600,000 and 700,000s.
Yeah.
And at that point, what you're going to find is if the T cells now are lower than 100 and the CD4s are greater than 100,000, what you're going to find is you're going to start having vision changes because it's going to attack the retina. So there's retinopathy that's going to occur in the disease process. You're going to have kidney failure. You're also going to start seeing Kaposi sarcoma, which is a cancer that pretty much has been eliminated from this disease, which is really a skin cancer that affects the body and affects the immunity. So we want to assure that if you're getting early detection, early intervention, and doing the right things, and that means eating healthy, getting rest, making sure that all of those things that go along with those cell counts actually have the ability to improve your health.
Okay.
So it really is about improving your health once you're known, preventing it from ever occurring, and then making sure that we don't pass it on to others. And one of those in what we're discussing here is from mother to baby.
Okay.
Then there were times in our country, in the U.S., where physicians would say, let's not have children. Now they coach and do some work around this to say it's possible if, and that if is big, in that you actually are taking your drugs, getting your rest, and that you're being followed by a physician.
Okay. Now, Dr. Eden, in the course of our discussion, we're talking about HIV and then we're also talking about AIDS. Okay. So now I want us to kind of differentiate these two, because in our discussion right now we did talk about CD4 counts,
right.
And you realize that CD4 count again has more to do with somebody having the AIDS. Okay.
Right.
Good. Now, if somebody has HIV, we kind of can separate the CD4 count out of somebody who has the AIDS. So let's be very clear in terms of knowing what HIV is and then what AIDS is. Okay. So I want that clear distinction so people don't get confused out there.
Right.
So who has HIV and who has AIDS?
So let's take HIV as a narrow street.
Okay.
We're going to look at it this is a narrow road we're on here.
That's right.
Now, this road of HIV means you have been exposed to the virus.
Perfect.
Now, in that exposure, you may be normal, and there's been people who have actually not had any crossover to opportunistic anythings on this road for a significant number of years. And in, I think in our region here, it's been reported as many as 20 years. But what that means is the virus is actually growing during this phase. It is actually starting to have health effects.
Okay.
And there may be that point where I don't feel well, but I have more colds, I have more flu, I have more other things occurring. But that is sort of the HIV trail. And that may happen, that road may take a while to get to the next phase. Now when you get to the AIDS phase, we have moved on to the highway. We're now a significant freeway. We have a lot of opportunistic things that are coming our way. The cars are coming at us here. And in those cars are things such as we're going to start seeing, we're going to see things such as we don't have the energy is the first thing we're going to see. We don't have energy.
So then does it mean that one can have HIV and not have AIDS?
That's right. One can have HIV, not have AIDS.
Okay, so then at what point are we going to say that so and so has AIDS? When you cross over?
When you cross over, that's going to mean that you have a detectable viral load.
Okay.
And that your T cell, your helper cells, those macrophages, those things that are attacking the things that come into our body are actually being destroyed by the virus, and we're not able to fight off any more of those things that are coming at us.
Okay, that sounds very good. To all our listeners, you are tuning to Ghana Tourist Coach Radio.